I don't know what you heard, what you didn't heard from what I said, but it's great to see everybody. I'll just leave it at that. Let me start with a little Zoom etiquette. If you're speaking, make sure you're unmuted so people can hear you. Let's make that number one. Also, some people you might enjoy early on when we're doing our fellowship, where you can get the screen where you can see about, what is it, 5 times 5, I think is 25 different faces at a time. But when we get into the program like now, you might want to change your screen so you primarily see the person who is speaking. And it will change back and forth depending upon if it's me or Lauren or Brian or other people that are speaking. You do that in the upper right corner of your Zoom window, where it shows speaker view or it shows gallery view. It'll say that up in the corner. For right now, if it says speaker view in the upper right corner, you probably want to click that so that now you see primarily me on your screen, and you probably see some others across the top you can scroll through.
That's what I see.
All right. Another thing I want to mention is that if you want to give some feedback, but you're muted, you can always go down to the bottom of your screen, kind of where the chat is and the list of participants. In the very bottom, if you put your cursor over it, you'll see a little reactions, which is kind of a smiley face with a plus. If you just touch that, you can click either clapping, which probably is not appropriate right now, or thumbs up if you find that you can find that little spot on there and give a little reaction. Thanks, Gary. Thanks, Colleen. Christy. All right, everybody. So the Zoom thing can be a little bit more interactive, even though oftentimes you're muted as other folks are speaking. I do ask that you remain muted if you're not the primary person talking, because oftentimes there's unexpected background noise that you shuffling papers or the smallest things can be picked up in your microphone. So please remain muted unless you're looking to talk. We talked earlier about the chat function. You can access that chat function in the lower part of the screen next to kind of that reactions. Let you know though, if you're emailing for IT support or something like that to Lauren, she's probably not going to be able to respond to you during the meeting because she's got a bunch of other things behind the scenes that she's working on. And if you don't see any of these options I'm talking about as far as Zoom, just put your cursor over the window and kind of move around, and it'll probably show up if you're not in the Zoom sort of active window. I'll stop there, and if that was useful or helpful, anybody, reactions? All right, there's Carter, thanks for the thumbs up. Colleen, again, Mitch, Christy, Gary, excellent. People are picking it up. Well done, Jeff. All right, so I will move now to where our inspirational moment. Christy Schaefer, that's why you're unmuted. You are ready to get going with an inspirational moment. So Christy Schaefer, we all know her as a past president of the club, but also as a vice president with junior achievement of the Rocky Mountain region. So Christy, what do you have for us today?
Well, I would like to share actually something that Peter Tedstrom shared with me a couple of weeks ago, and I thought it was very appropriate to share with everyone. So I hope that this will be new to a lot of you and give you some hopefully positive perspective as we continue on this journey through this pandemic. So Peter shared a writing by an anonymous author called "When This Is Over." It says, "When this is over, may we never again take for granted a handshake with a stranger, full shelves at the store, conversations with neighbors, a crowded theater, Friday night out, a taste of communion, a routine checkup, the school rush each morning, coffee with a friend, the stadium roaring, each deep breath, a boring Tuesday, life itself. When this ends, may we find that we have become more like the people we wanted to be. We were called to be. We hope to be. And may we stay that way, better for each other because of the worst."
Thank you, Christy. That's excellent. We can have hope and remembrance of those things, and hopefully find some enjoyment in what we're doing now, but look forward to when we can get back to appreciating those things all the more. That's great. Thank you. Thank you. I might even give you one of these. Look at that. There we go. Next, we have Brian Sweet with our secretary's report. And Brian Sweet, who works in the real estate space and says he's been quite busy lately, which is good news for him. Brian, what do you have for announcements today?
Thanks, Jim. Yeah, it has been busy, which is kind of surprising. And I'm kind of getting used to this whole Zoom thing. I've had a lot of meetings now. It feels like I'm doing them for everything. I have a Zoom meeting after this with my wife, and she's in the next room. So it's
And you're even keeping
crazy.
your kitchen real clean. So good for you.
I'm trying
Good
to.
job.
Yeah, I'm trying to. So per usual, I will start by announcing our guests that we have today. And so if I miss anybody, I apologize. But just got the list from Lauren, and we have District Governor Kurt Harris joining us, which is great. Kurt, great to have you. We've got District Governor-elect Bob Kemp joining us as well. We've got District TRF Chair David Willem joining us, which is great. We've got Graham Rogers, who's a prospective member and a guest of Melly Kennard. We've got Thomas Longino, and is it Longino or Longino? Either way, Thomas, you were here last week, so great to have you. We've got Fletcher Brown. We've got Chad Kroll, who's a guest of Jim Johnston. We've got Stephen Ball, also a guest of Jim Johnston. Chris Hemingway, who's a guest of Jim Johnston, and Chris Beasley, who's Debbie Beasley's husband. And I saw you in the video, Chris. So nice to have you. So let's give everybody a round of applause, but let's give them a thumbs up or a silent handshake or a silent clap to show to welcome to our club here today. I will go through announcements next. And as I mentioned last week, Rotarian Allison Euler Mitch, in her generosity, she's offering free online exercise classes to her fellow Rotarians through her new business venture, which is Refresh Studios. All Allison asks in return is that you pay it forward by checking in on a friend or a Rotarian, walking a neighbor's dog, donating blood, picking up groceries, whatever you feel comfortable doing to pay it forward. But again, thank you, Allison, for your generosity in that regard. And that's a good opportunity for people to try what she's offering. And another example of generosity, as announced in the email last week, our Denver Rotary Club Foundation and the club itself are jumping to action in response to the coronavirus pandemic and urgent needs in our broader community. So far, we have identified $17,500 from meal cost savings, foundation disaster relief funds, new project grants, and a matching grant from the district that will all be able to donate to these efforts. And to help with the effort to make a greater impact, we are asking that the club members do what they can to contribute to this effort as well. So stay in tune for after this for an announcement from our DRCF President-elect Carter Sales with information about the disaster relief task force that he's formed. And just in general, this is a perfect example of Rotarians doing what they do best. And I know things seem far from normal, but it's that time of year where we also nominate a fellow Rotarian for the annual Rotarian of the Year and new Rotarian of the Year, both awards. So let's help ensure that our Rotarians are duly recognized for their tireless work in the community through Club 31. That's all I have, and I think I'm going to turn over now to Jim and also Carter to again talk about the COVID disaster relief task force.
Thank you, Brian. Excellent. Well done. So Carter, yes, we're ready for you. And Carter is, of course, our incoming president with our local Denver Rotary Club Foundation. And Art Carter is also a broker in commercial real estate, should you need such work coming up soon for your next big adventure. Carter, what do you have for us on the foundation front?
Thank you, Mr. President. Good afternoon, everybody. Yes, I'm chairing the Denver Rotary Club COVID-19 Disaster Relief Committee. And we formed a committee that's comprised of Denver Rotary Club Foundation trustees, Denver Rotary Club directors, and then also several Denver Rotary Club members. We have 10 committee members in all. And just an update to our total funding, we now, instead of 17,500, we have 21,500. And that is, as Brian said, it's made up of Denver Rotary Club funds, Denver Rotary Club lunch expense savings. Then also the district granted us $1,500. So thank you, Mr. District Governor, for that. We really appreciate it. And then also member donations. So all of that combined, we have a very nice fund that we're going to be working with. We had our first meeting on Tuesday, and we're in the process of compiling a number of organizations to send grant applications to. Right now, we're evaluating about 25 candidates. What we'll do is we'll go ahead and send out invitations once those are evaluated. get the applications back, and then issue the grant awards. And our goal is to have everything wrapped up in the next 3 weeks by the end of April. So I just want to thank all the committee members for their work on this, and that we're really excited and honored to be able to apply these funds to these organizations. So back to you, Jimmy Jack.
Thank you, Carter. Thank you, Carter. People might not know that's the nickname for me, so thanks for letting that out on across the internet.
Hey, Jim.
All right.
Jim, just
Yes?
one quick question for Carter. How did you choose the organizations that are applying?
Well, there are a number of organizations. First of all, we have grantees that we, normally have through our normal granting process that's in process right now. We also have member-supported organizations. These are, members of Denver Rotary Club that are involved in a variety of organizations. Then also there's a list of organizations that Jimmy Jack sent to me. And, we're going to look at our areas of service, currently. So obviously youth, education, seniors, jobs, first responders, medical, and so forth. So what we want to do, two things. We want to make the donation size meaningful in terms of enough dollars to make these organizations want to apply. But secondarily, we really need to have the organization, the number of organizations manageable. So, that's what we're going to do. We're going to do our best to score them, and then also make sure that the dollars are, going across the segments of the, people and companies and organizations that are affected, in terms of economics and health.
Carter, this is Seth. Just a quick comment. The sooner those decisions can be made, the better, obviously, the needs now. And I've suggested a few organizations, as you know, and I'm not going to turn them loose on you, but they're already asking me what the status is, how they can provide information. Thanks.
Right. And I appreciate your email early, Seth. I've been multitasking all day, trying to save deals, trying to do extensions and so on. So
Understood.
I was going to get back to you on that. Your organizations are on the list. And certainly, we're going to move as quickly as practicable. But, there's a lot of things, we need to set our policies. We need to get, the applications. They're going to be online on Google Docs and so on. So there's a lot of things that we need to do. I've got a timeline together, and we're going to try to do it. And, we're doing our best as people's schedules permit.
Totally understood. Thanks for your work.
Okay, thanks for your comment too.
Carter, thank you very much for what you're doing on that front. We're all, here to help if there are ways we can help out. But we know it's in good hands with the decisions that you're making for us. So thank you for what you're doing there. Let's see. I wanted to jump now. There's a video prior to moving to our speaker today, which, as you probably all know, is in the medical world with Denver Health Hospital. We wanted to show a quick video to everybody just to set the tone a little bit here for what's going on. So Lauren is going to show us start the video. Enjoy.
You're broken down and tired of living life on the merry-go-round, and you can't find a fighter, but I see it in you, so we gon' walk it out.
These are simply not normal times.
There are thousands of new diagnoses in a single day. That's what we're bracing for.
I took an oath to save lives.
We're going to put on the line. We're going to do everything we can to save your life. And so we need your help to make that possible.
And I rise like the day. I rise up. I rise unafraid. I rise up. And I do it 1,008 times again. And I rise up. I like the waves. I rise up. In spite of the ache, I rise up. And I do
Thank you, Lauren, for finding that video and sharing it with us. It sets a great sort of introduction for what's about to follow here for us. And Ben Allen will do the honors of introducing today's speaker. Ben Allen is, of course, the chair of both our programs committee and our RILA committee, and he's the principal of Allen CIO, a technology firm. So Ben, why don't you tell us more about who's speaking today in the topic?
Great, thank you so much, President Jim. I'm really excited to hear that Kurt Harris, our district governor, is joining us. He's a friend I've known through Evergreen Rotary for over 20 years. It's my pleasure today to introduce Robin Wittenstein to our club. She's the CEO of Denver Health and has been in health administration and education for over 30 years. And for 20 of those, she has been leading organizations as a COO or CEO. One of her things that she's passionate about is serving the diverse community that Denver Health represents, and, for example, is involved in the economic freedom of low-income populations. She does this through a number of channels. She is a member of the Regis University Board of Trustees, the Downtown Denver Board of Directors, the Caring for Denver Board of Directors, and the Colorado Access Board of Directors. I did a little bit of research on Robin so that I could introduce her properly. And one of the things that I found out there was a quote from someone that said, "She is a professional who is willing to teach her employees how to become leaders." What we need right now from our leaders is hope and inspiration. And a bit of a spoiler alert, I know that this morning Robin was talking with the mayor of Denver about how Denver can become better because of this difficult time. And she told us this morning that she sees a silver lining. So Robin, thank you for joining us today. Please take it away.
Thank you. Thank you for that introduction, and thank you so much for giving me the opportunity to speak to you. I have to say, I think that the best thing that can happen in this day is to make sure that we all keep talking to each other, that we've got information out there that really lets us know what the situation is, and that we're as open and transparent as we possibly can be about what's going on, what's going well, what's not going well. And I firmly believe that as awful as this situation is, and I am extraordinarily hopeful that this is a once-in-a-lifetime situation that none of us will ever see again. But coming out of this, we will have learnings and opportunities to just be better and stronger and more unified in ways that perhaps we didn't think we could be in January. So what I thought I'd do today, and I know Lauren had mentioned that you had a physician come on and sort of talk about the medical components of this. What I thought I'd share with you is how the healthcare system is responding. And again, I think there are some places where the response has been incredible and other places where we've clearly got some work to do to make sure that we're ready for these types of situations in the future. And I'll use Denver Health as sort of the example, but I can assure you that the types of things that we're doing are the activities that every single healthcare organization in this country is working on. And that video was touching. And I think you would find healthcare workers across the country are doing everything they can to make sure that patients are safe. So when we started reacting, it was, the word started coming out. We were talking to colleagues around the country about what was going on. And we really started getting into planning mode in February-ish. We actually stood up our incident command center at the beginning of March. So that's how we are managing and controlling and organizing our entire response. And so I'll walk through a few of the things that we've done, and certainly there'll be time at the end for questions. One of the first things that we did is realizing that while there is a lot that was unknown then and even now about the virus, the transmission was significant, and there are high-risk groups that just needed to be protected from exposure to the virus. So one of the very first things we did was stand up a telemedicine program. And effectively what we said to our patients is, you need care, but we do not want you coming into our facilities for that care until we can be certain that we know whether you'll be exposed, what the risk is to you. So like many facilities, we've talked about telemedicine platform for a long time. Denver Health is what is known as an academic safety net institution. So the academic portion refers to the fact that we do research and we educate a lot of healthcare professionals. The safety net is really around the patient population that we serve. So Denver Health mostly serves an and underinsured patient population. So it's mostly uninsured patients and Medicaid. And they're people who need care but are, for a lot of reasons, the reimbursement is pretty low and most providers have some limit on the number of those patients that they can care for. That's what Denver Health exists to do. Now, we certainly take care of Medicare patients, we take care of commercially insured, but we have focused primarily on the most vulnerable patient populations and trying to provide care there. Knowing that even in the early days of the virus, we understood that underlying health conditions really increased a person's risk of having severe reactions and complications from the virus. Our goal was to keep our patients out. So we started by switching to telephone visits, and we're now doing video visits. Within about 3 or 4 days of making the decision to try to keep patients out of the clinics, we had switched about 75% of our visits to telephone or televideo. And again, that has been really important as an early means of helping to prevent transmission. At the same time, we said to our staff, we need you in the hospital. You can't be a nurse or a doctor providing care to a patient and do that remotely. But there are a lot of people who do not need to be in the hospital. So all of our support staff and overhead staff. So we essentially, in the space of about 3 days, stood up an entire telecommuting platform for our own employees. And we sent, in the first wave, we sent about 1,000 people out of the buildings and said, don't come back until we know that it's safe for you. And we've increased that number even more. Denver Health was one of the first hospitals in the city and county of Denver to be able to stand up our own testing platforms. So you've seen on the news and that testing has been a major problem with this virus. The best way to control a new outbreak like this is to understand who is positive, to quarantine them, and then to do the public health tracing that lets you understand who they've had contact with, and then isolate those people until you can be sure that they haven't gotten the virus. The challenge is if you don't know who has the virus, it's impossible to do that. Denver Health is actually the medical arm of public health for the city and county of Denver. So the public health department is with the city, but we are the medical arm of that. So we do all the medical pieces. And at the beginning of this outbreak, we did the very traditional public health contact tracing. And so we started finding people who appeared to be symptomatic, doing testing on them, and then quarantining and isolating. It quickly became a strategy that had no chance of success, because in order for that to work, you have to be able to test regularly. CDPHE stood up their testing as soon as they could, but the volume that they were getting was causing them to have turnaround times of anywhere from 5 to 7 days. And that turnaround time, if you could even get a test, just didn't let us do what we needed to do. So about midway through March, about 2 weeks into this, we were finally able to get our own testing set up. That has been a game changer. And I think all of the hospitals in the city are now able to do testing. But as soon as we were able to do that, we could then start testing patients in the hospital to see whether they really had COVID or not, and separate them into different units, so that if you had COVID, you were cohorted in a unit that all the patients had COVID, so you weren't exposing anybody else. And if you didn't, we could separate you out so that we could protect you as best as possible. The same thing with healthcare workers. That was the second group we started our own testing on. And again, the goal is, healthcare workers they have to come in and take care of patients, even in circumstances like this. But they are as afraid and anxious as anybody else is. And one of their biggest fears is that they are exposed to the virus and then they bring it home to their families. So you'll find healthcare workers understand that this is part of the job when you are a frontline healthcare worker. But putting your family at risk is a different situation. So as soon as we could start testing our own healthcare workers and tell them yes, you do, or no, you don't. That helped a lot. Our testing results are available within 7 hours. So we do two or three runs a day, and we can tell. As soon as we were able to test patients and our own frontline healthcare workers who are at risk, the next group that we went to was frontline first responders, police, fire, sheriff, and 911 dispatchers. From our perspective, and I believe also from the city's perspective, the police, the fire, the sheriffs, they are as much a part of the Denver Health family as anybody. We rely on them and they rely on us. So we immediately started testing there. We expanded next into the jail. So people who are inmates in the jail, that is an environment that is potentially ripe for somebody to get infected and then to pass it on. So we started testing in the jail. We were able to find inmates who were testing positive, and then they could be isolated appropriately so that the risk of transmission was reduced. From there, we've continued to grow. So as we can expand our testing, we have reached out. And in truth, the groups that we reach out to do testing for are typically the ones that may not have the resources themselves or may not be able to access testing. So the Colorado Coalition for the Homeless, which is one of our most significant partners, we're testing for them. We reached out to some of the small rural hospitals across Colorado, which are really struggling with this, and we're doing testing for some of those. We're testing for one of our nursing home partners that hasn't been able to get the testing appropriately. Skilled nursing facilities are another very high risk area. They're generally people who have, by virtue of age and their underlying medical condition, they're at high risk for, if they should get the virus, to have a serious course during it. So we want to identify people who may be positive and isolate them as quickly as possible. And we're continuing to expand. So on Monday of this week, we just set up community testing at our Montbello site. We're going to be testing patients who come in who are high risk so that we can identify and get them into treatment as quickly as possible. We'll next expand into the clinic we have at Penn. So I often say to people, you can't turn around in the county and throw a stone and not hit Denver Health somewhere. So we've got clinics across the entire region, and we're slowly but surely bringing that testing out. I think the most significant thing, and this is something I'm really pleased that we're at the point of, we've all heard about flattening the curve, and the idea is not that we are necessarily going to prevent transmission throughout the population, but that it's going to be done in a way that protects the most vulnerable and doesn't get to such a stage that we overwhelm the healthcare system. The next stage really is widespread community testing, identifying people who become positive and then quarantining them and doing the tracing around them to make sure that we've identified people who have been exposed and isolating them so that we break the chain of transmission. Our public health folks are actually laying out the plan now. We think we're probably within a week or so of being able to go back out into the community and restart that public health testing program. As we do that, that is our best weapon in getting us back to some semblance of normal, is knowing where the infections are, how prevalent they are, and how we can identify and isolate people who have the virus. We very quickly, as did most hospitals, we very quickly moved to cancel elective surgeries and procedures, and so people who needed joint replacements and other types of things are not getting those right now. I will get towards the end, we are in the process now of beginning to discuss how do we restart that. But we've also done, I think, some interesting things. We have developed, and we're talking to the state about a hospital at home program, where people who are sick but don't necessarily need to be in a hospital bed can be cared for at home using a combination of medical equipment that we'll give them, so blood pressure cuffs and pulse oximeters, things like that, and then 3 to 4 visits a day virtually by video, where a nurse can check in a couple of times a day with the patient and their caregiver, where a doctor can do a visit every single day, and actually where we can have a behavioral health specialist also check in. somebody who could be getting their care at home, that's still, I don't know, you've probably been involved in the care of somebody who's sick. When they're sick enough to require hospital care, but they're at home, we want to make sure that the patient and their family are feeling comfortable with what they're doing. But again, being in a hospital when you don't need to be in a hospital is never a good idea. And I say that as somebody who has a lot of experience with this. It's always better not to be there if you don't need to be, but we want to make sure that it's safe. We've also spent a lot of time and energy on increasing our capacity to take care of patients. So in the normal course of events, Denver Health has 47 intensive care unit beds. I'm sure you've heard that one of the challenges with the coronavirus is the number of people who become so seriously ill that they need to be in an intensive care unit or on a ventilator. We worked immediately to increase from 47 beds up to 67. We're now up to a capacity of about 115 ICU beds. And if we need to, we can increase to 150 ICU beds. We've increased the supply of ventilators we have, and we continue to look for additional ventilators. Personal protective equipment has been a challenge, and this is across the country, and it has been a challenge here as well. Making sure that healthcare workers have the equipment they need when they're interacting with patients who may be COVID positive has been a struggle. This is one of the areas where I have to say the community has been supportive in a way I never would have imagined, and I am truly amazed at. So we put out calls for anybody who has masks, gloves, any protective equipment at all, call us and let us know. We have had pallets of masks and gloves donated. We've had people reach out who have connections into industries that use these kinds of pieces of equipment, and just bringing them to us by the bucket loads. We are in a comfortable place right now. We're not about to run out of PPE. At one point, we were seriously concerned that we would be put in a position where we would have to ask healthcare workers to take care of patients with the virus and not be able to provide them the protective equipment. And honestly, I'm not even sure how we do that, because how do we put people at risk, not only themselves, but their families? And I don't know how I ask that of employees, but by the same token, we've got people who are critically ill in beds who need nurses and doctors to take care of them. So thank goodness, at least at this point in time, it doesn't seem as if we're going to have that problem, and we continue to work to try to find additional supplies. As I said, we are moving forward on a community testing program. We're going to coordinate this with the city. We're working on some possibilities for a widespread testing, serology testing, which really says, do you have antibodies in your blood that tell us you either have the virus or you've already had it? So we're working through that. I guess the best part of the message is it does seem, when we look at the data here in Denver, and across the state, but particularly here in the city and county of Denver, that we have seemed to have stabilized the number of cases. So we were seeing rapid increases. That isn't the case. I don't want to jinx this because things could change. But it feels as if the entire city has stabilized on the number of cases. I think we're beginning to come to terms with what we can only describe as our new normal. The likelihood is we will be dealing with coronavirus for quite some time to come. The estimates are that maybe 10% of the population has actually been exposed and had coronavirus, although we don't know that for sure. But that suggests that there's a large portion of our population that has not. So the social distancing that we've put in place has really made a difference. It has stopped this from becoming what you see in New York. And I have colleagues and friends. My daughter works in New Jersey at a hospital. She tells me every day what's going on there. I actually spoke to folks from the hospital I used to run in New Jersey. And it's horrible. It's truly horrible what they are going through right now. And we have avoided that. And we need to make sure that we don't get into that situation. So as we begin to talk about our recovery plan, and we are, on Monday, I'm going to be setting up a group to start talking about, okay, what does recovery look like? What does it mean for our patients? How do we begin reintroducing them into the clinic? How do we start doing the surgical procedures that we know that they need, but do so in a way that's safe for them and safe for the employees? I'm hopeful that mid-May is when we can begin that process. So we'll go through the end of April with the stay at home and social distancing. When we start to take those orders away, I think one of the things that is most important for everybody to know is this is not a light switch. We're not going to go from April 30th to May 1st and all of a sudden we're going to be, everything's going to be back to the way it was. This is going to have to be a very careful and thoughtful way of removing the restrictions so that we can, in fact, reintroduce people back into the workplace. We can have people be able to go to parks and churches and synagogues and all those kinds of things, but do so in a way that still keeps us from just having another flare-up. Because the risk is, if we go too quickly, we risk having all of the work that we've done up until this point undone and just get into the same situation that other cities are in. But the good news is truly that we are at a point where it is reasonable to be thinking about that and to be thinking about how we're going to prepare for that. So in the conversation that I had with the mayor today, it really is around, okay, when do we start? What are the triggers? What are the things we need to see in place in order to do this? And I just want to end with, and then certainly I'll answer whatever questions people have. I do want to end with our thanks. As I've gone through this, and I can tell you, and it isn't me, but the staff, the commitment of the folks here at Denver Health who are trying to deliver care and make sure that people are safe. I've been doing this for 40 years, not 30. And I have to tell you, I've never seen anything like this. This is hopefully, as I said, a once in a lifetime, never to be repeated event, but I have never seen an entire industry come together to do what is being done today. But it would not be possible if it weren't for the community. So I often say when I talk to people, I get to be the face of Denver Health all over the place. And when I'm standing somewhere and talking to people, I know that I might be standing there by myself, but I know that I have 7,500 people standing right behind me, because Denver Health as a whole comes together. In this instance, it isn't me standing there with 7,500 people behind me. It's me standing there with 7,500 people and 700,000 other people standing right next to us. Everybody working together, the expressions of support. Food has been pouring in to help support the frontline workers. We had set up a COVID-19 disaster fund, and money has been coming into that to help support the frontline workers. This is going to be a significant financial challenge for all of our institutions. We know we're going to have operating losses that come out of this. There are federal dollars available. They won't take care of it. But we are doing everything we can to not only take care of our patients, but also to take care of our employees. The economic situation in our community is terrible, and it's going to take us a long time to recover. Our goal is to make sure that we take care of our employees to the best of our ability and not have them added to the ranks of people who are suffering because of this. So I want to say thank you. I want to say thank you to all of you as representatives of the community for all of the support that has been offered, and give you our commitment and pledge that we are going to do everything we can to make sure we provide health care that people need in a way that is safe and effective, and that we do our part to help not just our patients, but the entire community begin to recover from this. And that we take a hard look in the mirror at the people who have gotten COVID and the disparate impact. You're seeing in the news now, African American population has been hit much harder in terms of severe outcomes and even death than other populations. I think we need to look and say, why do we have the kind of inequities and disparities that we do? and what can we do to erase those so that if and when this happens again, we don't see that. And then the final note is we will get the stay-at-home orders released. We will get back to a semblance of normal, and we will see that we have to deal with coronavirus for quite some time to come. This is not it's done by June and we never have to think about it again. It's here. We don't have immunity to it because we've never seen it before, and it's going to take us some time before we get to that. So much of what we have to do in terms of keeping each other safe is going to have to be used, tempered, but used until we have a vaccine for this. So with that, I will stop, and I'm happy to answer questions. And if there's anything I didn't cover that you'd like to know more about, just let me know.
Robin, thank you so much. Club 31 members and guests, we're going to try to keep the questions organized today as much as we possibly can. Down on the bottom of your screen under the participants section, there is a raise your hand feature. Please raise your hand, ask a question, and then please type your question into the chat section, either directly to myself, which would be the best, or in the general chat, and we'll get to them in order. We already have 3 in the queue. I have Andre's, I have Paul Jones's, and I have Mary Penny's lined up. Others, please raise your hand, and then also please type your questions in the chat. Thank you so much. We'll move through these as we go along. Robin, our first question is from Andre Von Hollen. Andre asks, this all started with one case in China. Once we reopen the economy, how long will it be before we accelerate the curve we have been trying to avoid?
That's a good question. I think it depends on how well we continue to practice social distancing. We're not going to be in a position where we can start to gather 25,000 people in a room all at once. We're going to have to maintain some degree of social distancing, and we're going to have to be careful about how quickly we bring people back into workplaces and into restaurants, etc. Part of this is going to be dependent on how quickly we can get to more widespread community testing. The sooner we can test and know who actually has a coronavirus on not just the people who are obviously ill, but even the pre-symptomatic and the asymptomatic, the sooner we'll be able to implement public health measures that actually can keep all of us safe. Quarantine people who are positive and isolating people who may have been exposed. So this, how fast we get back to normal, or how we prevent the acceleration of the curve, depends on how well we all behave. If we think that everything is just fine and dandy, we will likely see a significant uptick in cases again. And the other thing is, as simple as it sounds, wash your hands. It really and truly is the best defense you've got against the coronavirus.
Thank you, Robin. Robin, our next question is from Paul Jones. Have you had pushback from the state or AMA doctors about the home hospital program?
No, we haven't actually. We've had a lot of the idea for the hospitalization at home actually came from our clinicians, and it was from one of our internal medicine physicians who takes care of a lot of people who are who may need hospitalization. And what they've suggested is there really are a couple of populations that this would be most appropriate for. It could be for COVID positive patients who are low risk in terms of comorbid conditions, who can be cared for safely at home. For many patients, so the vast majority of people who get the coronavirus will have a course of illness. It will range from you sort of notice it to complete, very unpleasant, but they will recover and they will be fine. There are a smaller subset who have to be hospitalized at all, and an even smaller number who end up in an intensive care unit or on a vent. So patients who are at the low end of that, they may need some hospital care, but they don't have a severe case, could be cared for at home. But there are also other chronic conditions, and I'll use congestive heart failure as an example. Congestive heart failure is a condition that, unfortunately, it tends to be older individuals. There's oftentimes a repeat number of admissions into the hospital. That is something that can potentially be managed at home. So the clinicians have actually come up with some very sophisticated algorithms for those decisions. The state is very interested, and I'll say the state's been interested, you know, and they're cautious. They want to make sure that it's done appropriately and safely for patients. The interest is partly because we know that being in the hospital is not the best place to be if you don't have to. If you're not COVID positive and you can stay out of the hospital and you can get the care you need in some other way, that is better for you. But the truth is, you know, we are a society that tends to hospitalize a lot of patients, and there are other ways to do this. So part of what we're taking out of this as our learning is, are there ways we can provide safe and appropriate care to patients in a way that's really more patient oriented and that costs less? You know, healthcare costs too much money, and we know that it puts a strain on our entire society. It puts a strain on the people we serve. I know that every day we've got people who walk into our clinics, you know, mothers who walk in with their kids, and their decision that day is, do I buy medicine for my child or do I feed them? That's not a decision anybody should have to make, and we know that that is a decision people face every day. So our goal is to use this to say, can we deliver care differently and save money to the system? And I think the hospital at home program may be part of that.
Thank you, Robin, very much. The next question is from Mary Penny. What can we do to support the frontline workers at Denver Health and throughout our community?
That's a great question. And, you know, we've got people who are doing all kinds of things. As I said, there are restaurants and groups in the community that are delivering food on a regular basis. And that is, you'd be surprised at how much it means to the nurses in the middle of the night when, you know, our cafeteria happens not to be open in the middle of the night, when they can come downstairs and just sit down and get a meal. We've had lots of donations into our employee assistance program. One of the things that will impact healthcare workers, but in truth is going to impact all of us, the kind of psychological stress that people are facing now is going to have a long-term and lasting impact on all of us. And so part of what we're doing is looking at how do we begin thinking not just of next week or the middle of May, but how do we think about the next 6, 12 months, years, to help people who they're struggling with isolation. You know, their entire world has been uprooted. So part of what we've been seeing from the community are offers to help with that. And again, it'll be for frontline workers, but it's going to be for all of us. We're going to have to face up to the fact that this is going to have a psychological impact on our entire society, and we need to be prepared to deal with that. So if people want to help, we actually had a group of school children handwrite cards to the frontline workers to say thank you. So, you know, little kids, and actually what we did is we took pictures of them and showed them to the frontline workers so we didn't take chances of spreading things. One of the local performance companies has done a virtual performance for our healthcare workers that we're going to be sharing tomorrow. It actually means a lot to the people who are trying to take care of patients to hear how much the community supports the work they're doing.
Thank you, Robin. We'll try to get through all the questions. Thank you so much for everyone for following the process. The next question is from Carter Sales. Who can we talk to donate to the COVID Disaster Relief Fund?
So if you're interested in donating, the best way to do that is either to go onto the Denver Health Foundation page, and I think there's a little donate now button, or you can email the director of our foundation. Her name is Linda Ford, and her email would be linda.ford, F-O-R-D, @dhha.org. And again, the funds that are coming in are being used for support of our frontline workers, for our employee disaster fund, to help expand our telemedicine, and actually to help expand our behavioral health services. Denver Health is one of the largest providers of behavioral health services in the community, and I think we're going to be stressed to be able to meet the needs of people as kind of this sinks in.
Robin, thank you. This kind of feeds right into that. This is a question from Jill Santuccio. Talk more about, please, the disparity piece. While it's great that there are telehealth and video visits, what about populations who don't have access to that technology? How can Rotary help with that?
That's a really good question. And we know, again, Denver Health gets to see the most vulnerable people in our community. So homeless, people who are suffering from mental illness, substance abuse, the Medicaid population that's working 2 and 3 jobs trying to take care of their families. One of the things that we're going to be doing is working to not only expand the telemedicine, but to provide the equipment that patients need for that. So some of it's relatively low cost, just giving blood pressure cuffs and pulse oximeters, as I said. But we're actually also going to be applying to the FCC has a grant program to help expand broadband to people in need in communities. And that is absolutely something that is right. I mean, it doesn't help to have telemedicine available if somebody doesn't have internet or a smartphone of some sort. So we're working to identify funding sources so we can help address this. People should not get care because they don't have the money for a internet service.
Okay, we need to bring the questions to a close. I just have one more quick question, and this comes from Jim White, one of our members who just recently lost his wife, and he asked, I want to get my wife buried, but can't have the service. How long should I wait to plan it?
Oh goodness. Well, first
That's a tough question.
Yeah, it is, and I'm terribly sorry for your loss. That type of loss is never easy, but it's certainly made even worse by the uncertainties that we're all facing nowadays. I do know that services are going on. I actually received notification today that one of our employees' husband died of COVID, and I know the services are Monday. I'm planning on being there. So I can't give you a specific answer. I think the challenge is really we are not going to be able to have services in the way that we normally would and let people come together in shared grief. I think that what will end up happening is there will be very small and private ceremonies, and then we'll have to probably sometime later this summer come together for that sharing of grief.
Robin, thank you so much. Club 31 and guests, thank you so much for following the procedures, and we hope. Sorry, we could not get to all the questions today, but thank you so much, everyone, for being so engaged.
And I would just say, if there are other questions that people would like to ask, you could feel free to email me, and I'll either answer them myself or if it's appropriate for somebody else. My email address is robin.wittenstein, WITTENSTEIN @dhha.org. And I'll just ask a little bit of patience. Even as I'm standing here on the phone, I think about 200 emails have come in. So we will get to them, I promise. So feel free to send an email if there's anything we can do to help.
Robin, we are so grateful for your time today. You are busy. 200 emails in your inbox since you've been on this time with us today is I'm sure a small example of the pressures that you're dealing with right now. We've had already one thing in the chat box. One of our members gave an anecdotal story about great service that a friend of his had at Denver Health very recently, unrelated to COVID-19. But you guys are just, you're keeping the ship afloat in extraordinary times with extraordinary service that you're giving us, and we're grateful. And I hope that you can do all you can to take care of yourself, and so that you can keep doing this great job. So
thank you. We're all in this together. We're all in this together.
We are. One thing that Club 31, our Rotary Club, likes to do is give a gift in honor of our speaker. And today we will be giving a gift to End Polio Now, Rotary's effort to eradicate polio from the world. And when our gift is combined with the Bill and Melinda Gates Foundation, 100 children will be inoculated from polio. And that's in honor of you. So again, thank you very, very much. And we appreciate it.
Thank you. And I'm going to sign off now.
Okay, please do. Next week's program, a quick announcement about that. We hope that you can join us. We have a discussion also related to what's going on in our world today from a scientific perspective. And I don't know the exact details other than the name of the topic and the speaker, so I'll mention that to you. But I was told it's about trying to find a vaccine cure to the virus that's out there from a scientific perspective. But it's next week, same time. The title of the program is Time Has Come to Change Imaging and Targeted Therapy. It's Terry Collop, who's the founder and managing member and CFO of CellPoint of CellPoint, which is a research firm out there, and Rotarian of Denver Southeast. So that's next week's program, and we'll hear more about that when the announcement comes out from Lauren. Wanted to ask everybody, this is our third time doing the Zoom meeting, and many of you have filled out the program survey that does go out every week, and it will be in your inbox shortly if it's not there already. But please take the time to fill that out, maybe before you hop off of your computer right now. Let us know how it's going, any comments about these online meetings, anything that we could be doing better, or if you just like it. I mean, it'd be great to hear from you. If for some reason you're not able to make it next week or sometime, please let us know that and answer it regardless every week, whether you're with us or not. Let's see. Also, this meeting today, we're going to have to close it down just after we finish here when I whack the bell, because we have another meeting following up to this one immediately in this on the Zoom conference with our executive team. So executive folks, we'll see you momentarily. Two more things. I neglected accidentally to not do the Pledge of Allegiance to kick off the meeting, and that is my error. We did talk about perhaps doing it a little bit differently this time. It gets a little bit confusing, I think, when everybody says it at the same time with their phone, with their microphones unmuted. So I'm just going to lead that through us, and I encourage you to still put your hand on your heart and speak along with me if you would like. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Especially important at this time in our community. Lastly, we'll finish up as usual with our four-way test. And I will recite this one as well for all of us, but I encourage you to all to say it along at home with me. Of the things we think, say, or do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And will it be beneficial to all concerned? With that, we are adjourned, and I will ring the bell.